Hi, so I want to talk about the possible risks of the current measures in place of the self-isolation, and that involves all the businesses and organisations of a social nature that have been shut down. And there's a growing concern at the moment about what are the possible risks to so many different groups. So I just want to come on and sort of discuss a few of those issues that seem to be quite important. I've got actually a list of possible groups that I think may be at risk at the moment, but that might obviously change and grow in time. In particular, I think there's been a lot of concern recently about people with long-term physical conditions, especially long-term serious conditions that may require regular appointments, possible tests to determine causes of treatment, and various courses of treatment. And so many appointments have been cancelled, even for many illnesses of a serious nature. I think there's a lot of concerns about that at the moment. The Financial Times report that half of UK beds are currently empty, with 60% of acute beds occupied, 30% less than this time last year. A&E admissions currently are reported to be down by 50%. Why that is, one can speculate, whether there's less accidents perhaps, or it could well be that some people are just too frightened to go to hospital for fear of a risk of infection, especially considering some of those will have long-term problems with serious health conditions, so they might be more at risk, because most of the people reported to have died from the infection actually have got long-term pre-existing conditions. The Health Service Journal, the HSJ, they report the NHS has 4 times as many beds at the moment. 40% of acute beds are unoccupied at the moment, and there are 4 times as many beds as would be normal. So they obviously cancelled a lot of the appointments with the expected anticipation of a whole flood of different infections, patients with infections arriving. But there's obviously large numbers that haven't arrived. So there's a lot of questioning regarding, although so many cancelled appointments for various, checkups and treatments of a varying sort. The Daily Mail reports that thousands of heart attack and stroke victims are now waiting at least 2 hours and 20 minutes because they're currently being classified as Category 2 calls, although the NHS guidelines claim that their target for response for this kind of condition would be 18 minutes. But the Daily Mail report that there are claims from call handlers that there are often delays in hours, and some delays are up to 4 hours in ambulances. So there's obviously some growing concern about that, and in particular for those with heart problems. Cardiovascular disorder, in fact, is the largest known killer of fatalities, not just in the UK but globally, in fact. So there's a growing concern about a number of different conditions that may not be treated in time, and there may be significant delays. Sarah Scobie, Deputy Director at the Nuffield Trust, she reports that the PHE, that's the Public Health England, their data suggests that the problem could be significant. The data suggests that there could be significant problems already developing for heart disease related conditions for those patients. For example, attendances relating to myocardial infarction at emergency departments, those have dropped right down, whereas ambulance calls in relation to chest pains have gone right up. So one might speculate as to the reasons why that is, and what kind of cause that might be. But as well as concerns about possible long-term physical conditions, there's also a number of concerns about possible long-term social psychosocial disorders, mental health problems, and there's been some growing data concerning that. The Disaster Distress Helpline, which is a federal crisis hotline that runs at the Substance Abuse and Mental Health Service Administration, they report that in March they had over 338% increase in their call volume compared to February. And compared to March of last year, the same month, they had an 891% increase in their amount of calls that they're receiving to their crisis hotline. So we're obviously seeing huge increases, but that's being reflected in a wide number of other figures too. For example, in LA, their suicide crisis line has seen a vast increase reportedly. The Daily Mail report again that there's been a 75 times increase in the number of the previous month. Out of 1,500 calls, the crisis line report that 1 in 5 had reported and expressed a desire to kill themselves. That was a report from the Daily Mail. The NHS 111 service reported that they have seen numbers increase by 400% since the lockdown began, report The Guardian. Domestic violence charity Refuge are announcing 25% increase in calls to the National Domestic Helpline. Last year, 1.6 million women and 786,000 men reported some domestic abuse. The Spanish Ministry of Equality are reporting that calls to the emergency number for domestic abuse have gone up 18% in the first 2 weeks of lockdown compared to earlier. Well, they've had many weeks more of lockdown, so I wonder where that's at now. Between 18th of March and the 5th of April, CNN reports that domestic abuse website searches have more than doubled in the state of New York. The National Commission for Women in India, they're reporting double the number of domestic abuse cases in just the first week of the national movement restrictions there. So clearly we're seeing that there's a clear effect happening there in different countries. It's pretty widespread. The French police are reporting a nationwide spike of about 30% in domestic violence being reported. France and Spain, the French and Spanish authorities, in fact, are so concerned that they have now launched an initiative where they're giving victims code words that they can use to get help when they go out to visit pharmacies. That data came from the Justice Gap doing their research. Well, there's been widespread reports of increases in the amount of calls being received by various support hotlines, and they really are receiving vast numbers more, as one would expect since the lockdown began. So we're seeing, vast increases from all the different countries that have had the lockdown. So that's, we're seeing that being wide ranging. In fact, the issue in the UK in particular is quite concerning. It's been claimed by some reports that since the lockdown, domestic abuse killings have already reportedly doubled in the UK, claims The Independent from their report. On the 9th of April, the Domestic Abuse Commissioner, Nicole Jacobs, and the Commissioner for England and Wales, Dame Vera Bard, wrote to ministers, and I quote, "We call on you to offer a hotel free of charge to women fleeing domestic abuse where they have unable access to refuges." They're really struggling at the moment to get any access to the refuges. That's according to The Guardian. And The Guardian claimed that hotels and hostels are in fact offering the government thousands of rooms that they can use as a refuge for victims of domestic abuse. Well, because of the lockdown at the moment, due to those regulations, people that are victims of those abuse don't have anywhere they can go. They can't just turn up at a friend's or family's house, perhaps, that they would normally do. And actually, refuges have been so underfunded over the years of austerity that they are currently reporting that they are at breaking point and unable to offer women and their children, and even men, I suppose, they're unable to offer them at present a safe refuge. So they're currently calling on the government and asking them to either increase their funding or at the very least to provide some adequate shelter as a temporary relief to victims of domestic abuse. In fact, here's an article from The Independent on that very matter, and I'll quote it. Though Patel, who is one of the ministers, I believe, though Patel has said that the government explained alternative accommodation, though Patel has said that the government explored alternative accommodation for survivors, it seems some of the more logical options have been left off the table entirely. Instead of taking up offers from the hostels and hotel chains, offering thousands of rooms to women and children fleeing domestic abuse, the government seems to have entirely dismissed an incredibly helpful means of ensuring people have a safe space to turn to. So despite promises in a press conference on the 11th of April from Priti Patel, a government minister, who promised where a victim and their children do need leave, we will ensure they have a safe place to go. That was a government announcement on the 11th of April. However, women's refuge centres have not received that funding for additional emergency accommodation, reports The Independent just a few days ago. They're still waiting weeks on to hear a response from the government. Well, Jennifer Nadell, co-director of Compassion in Politics, described the government's response as foot-dragging at its most unnecessary, irresponsible and lethal. The government, however, have pledged £2 million to help fund support telephone lines during this time. But despite launching a Home Office campaign with the Twitter hashtag #YouAreNotAlone, they have so far failed to provide the sanctuary and adequate funding that is necessary. I'm going to quote an Independent article written by Ellie Fly, and I absolutely agree with her word for word. She says, for an indication of just how shamefully inadequate the initiative is, consider the fact that women's refuges are already operating on a shoestring before the pandemic, following a decade of austerity, which slashed funding for refuges. 1 in 6 in the UK have been forced to close since the 2010. This means that refuge spaces are already sparse, yet the demand for them is on the rise. More than 25% of frontline services have reported an increase in caseloads since the start of the pandemic. To give you just a sense of how pitiful the £2 million offering is, Women's Aid, a charity, have said that an emergency £48 million is desperately needed to support frontline services during the crisis, 84% of which have been forced to reduce or cancel their services in the wake of the pandemic. That's from an Independent. The Independent article. And so clearly there's critical cases from various countries at the moment regarding potential risks of domestic abuse at the moment. At least the French government are providing adequate support. I hear various reports are suggesting the French government now are paying for victims of domestic abuse to stay in hotel rooms for the temporary crisis. I hope that the UK government respond as soon as possible to provide that adequate emergency accommodation, and I would urge them to do so, and I hope other people do too, because it obviously is quite a concerning issue, that for people that perhaps have nowhere to go and are trapped in difficult situations. So there are obviously vast groups of people that are potentially struggling and having a hard time. It's all very well for some of us to say we're fine and, we're frustrated. It's just an annoyance for many of us. It's perhaps boring. It's a bit numbing. We're sort of, limited to some extent of what we can do, but there are many other people, in at-risk groups that will potentially be struggling much more with the measures, and that will potentially continue to rise much more. And we're seeing that coming out in the data now from the various reports from various charities, reporting a rise in the number of calls to crisis lines, suicide lines, and various other support lines. So we really need to make sure that as much support at least is given to help the most vulnerable, and to investigate what more support could be given. And I suppose to investigate what would be the continued risks if those measures were allowed to continue more long term. Because it stands to reason that potentially vulnerable groups under already a lot of stress, if they continue to be isolated for longer periods of time, their problems could increase exponentially. So we do need to sort of concern ourselves with that. It's not about trying to spread panic or worry to other people, but it's trying to look at practical means of helping support others throughout the situation. One other thing I thought was interesting to look at in terms of mental health was the alcohol consumption that's going on at the moment since the lockdown. Well, the BBC reported that, I quote, off licences which were added to the government's list of essential UK retailers last month saw a rise of 31% in volume terms. Although with most drinkers buying from supermarkets, that only contributed to less than 1% of alcohol sales. The BBC reports that alcohol sales in supermarkets and corner shops have jumped by 22% in March, according to consumer analyst Kantar. Total sales of wine, beer and spirits topped 1.1 billion in the 4 weeks up to 22nd of March in the UK. And that was an extra £200 million added compared with the same period in 2019. So we're obviously seeing a huge increase in alcohol in the amount of alcohol bought. Well, the first week or two of lockdown, there were a lot of panic buying. So perhaps some people were just stocking up on the alcohol without necessarily drinking more. Well, Alcohol Change UK, a charity, commissioned a study from Opinium on the drinking habits of the UK, surveying 2,000 people. And the results are 1,800, that's 1,800 of the 2,000 had drunk at some point. More than 1 in 3 reported that they had stopped or reduced their drinking, which really surprised me. 6% have stopped entirely. However, roughly 1 in 5, 21%, reported drinking more heavily since the lockdown began. That would indicate that perhaps approximately 8 million UK adults are now drinking more under the lockdown. Half of drinkers reported drinking about the same amount as normal. 15% reported drinking more per session. Most people who are drinking more are drinking also more per session. It's the people who are drinking the least who have cut down the most. 47% who drank once a week or less have reduced or stopped. 27% reported who drank 2 to 6 times a week have reduced or stopped. But worryingly, only 1 in 5, that's 17% of daily drinkers have reduced or stopped. And nearly 1 in 5 of daily drinkers have further increased their consumption since the lockdown measures began. That's a little concerning, perhaps. 1 in 14, that's 7%, reported that they felt that alcohol had made the tension in their households worse since lockdown. That could approximately equate to roughly 3.5 million adults if you extrapolate those figures to the general population. 1 in 7 people with children under 18 reported that alcohol was increasing their tensions at home. whilst only 4% reported that alcohol was actually lessening their tensions. That's concerning because over 200,000 people, over 200,000 children, in England alone, according to the charity, live with an alcohol-dependent parent or carer. 14% reported taking drink-free days. 9% reported being more careful about the alcohol consumption. 6% have stopped drinking altogether. 4% have sought advice online about alcohol. 3% have received one-to-one counselling remotely. And 2% are now using apps to help them to monitor their own drinking consumption. So there's mixed reports. Whether people are reporting accurately about their consumption, I'm not totally sure, but it seems like some people are sort of being more sensible, perhaps, a limited number drinking less, a larger group that probably are drinking a similar amount, and a smaller minority that maybe are struggling and drinking a lot more by the sounds of it. So it sounds from those reports that there are mixed sort of experiences going on at the moment. Mental health is only one kind of concern at the moment, though, and certainly trying to sort of reach out to contacts and provide practical support, certainly through technological means where you're able to, whether that's through texting, Skyping, through Facebook, Twitter, or other social media networks, or telephone, letter writing, or whatever is the most suitable communication for others. That certainly trying to contact other people that we think may be at risk is certainly a good thing to do in terms of that. I wrote some notes the other day that I felt concerning mental health, that I felt that there might be an increased risk of pathological mental disorders for those with moderate to severe problems, and those more dependent upon support groups might struggle more. They might struggle with anger issues, depression, addiction, alcoholism and drug abuse, anxiety disorders, dream reality confusion, which occurs when you're not seeing other people and you're lacking that perspective, paranoia, aggression, self-abuse, spousal abuse, domestic abuse in general. Those are all the kinds of risks, with an increased risk potentially with some for suicidal and or homicidal tendencies, if under enough stress and without enough support for a prolonged period of time. Can there be ways of mitigating those risks, perhaps with online and telephonic support that may help to reduce those risks to some extent? But that may not be as effective as the one-to-one or group therapy sessions in person. But even though that support through various technological methods, though inferior to personal direct communication, still could help provide a degree of support and might be significantly better than no support at all. However, online support through social media could be as damaging as helpful depending on the nature of that communication. That is to say, social networks can be a source of both positive encounters and negative ones also. The vast majority of those with the most severe psychosocial problems will have some recognition of those long-term issues, and they are therefore more likely to have a regular allocated support already in place, and so likely a continuity of care will likely continue from their key workers, whether they are support workers, care assistants who will be visiting individuals at their homes, or staff helping to support them at supported housing and care home complexes. This support will depend on the availability of such key workers to maintain the contact with their clients. However, there will be potentially a significant, much larger group who have less severe problems and who don't therefore have an official diagnosis or any formal care recognised in place. This group is potentially more concerning because more than those with severe issues, even if this counterintuitive, because they will have no formalized recognition of their support needs. They will have no access potentially to those support groups and care workers. They have enough problems that they are more dependent on support groups than those perhaps with more minor mental health problems. And during the isolation, they may face significant problems. This group is also more concerning than those with severe issues because they are also potentially a much larger group of the population. They have potentially as well then no guaranteed continuity of care with any official support. Their support tended to be more informal through contact like friends or family or colleagues at work. It is thus this group that is much more critical and concerning potentially, that we need to be concerned about making sure that we contact where concerned. This additional struggle for those with moderate mental health problems is that many of their contacts will also potentially have challenges too. Thus, without sufficient support from many others, it could become the blind leading the blind, or the mentally ill caring for the mentally ill. This itself has the potential to be of great opportunity for people to learn and develop abilities to help rise to the challenge of striving to support others in whatever capacity they're able to. In short, many are more likely to care for others much better if they have to do that in order to care for themselves also. The dangers, however, of this increased responsibility will be that there may be people quite overwhelmed and at times mentally or emotionally not able to cope with that level of care that's being pushed upon them, and not able therefore to provide an adequate level of care and support to others. So there are some concerning issues as the weeks go on, but it's not just limited to those with physical and mental health problems. There will be many other groups that will be concerned as well, thinking about those that are single parents potentially and that may have depended upon a support network and the extended family perhaps much more than others. Key workers with their children and family that are now having to look after their children who are now out of school, as well as juggling other jobs and other responsibilities too. Young children especially who may have been more dependent upon meeting up with their friends for support, and used to going to church or mosque or synagogue or temples or their school to engage with their various peers and their support groups. And of course, adolescents as well, they will be feeling a lot different than others. They may well be more dependent upon their support networks and their friendship groups. And as the months go on, it may be much harder for them. There's also an online issue, as they'll be more dependent upon support from online. It's good that they have that in place to contact their friends and others, but we know that there are those online that prey on the vulnerable, and we don't always know how safe they will be online, and in terms of who they're contacting and whether people genuinely are who they say they are. So it's important, for adults to make sure they're talking with adolescents, engaging them in talk, to be concerned about whether they're using that technology appropriately, whether they're safe, and, talking to them about it and, making sure that they're using it in a safe manner. Because obviously if they're using it more and dependent upon it more, because we're all going to be more dependent upon that technology, of course. There's also an issue with crime as well at the moment. Well, the police at the moment are going to be quite busy trying to police social distancing. We've heard numerous reports about the police going out and policing parks and woodlands, going around town centres. I've visited them. I witnessed them, and their presence on streets, in town centres, in parks, to make sure that there are no large gatherings. And obviously the police are going to be quite busy with that. But what does that mean for in terms of policing other crimes like the domestic abuse we're talking about, and a variety of other crimes like child abuse, for example, violence in general. How are the police going to be able to manage those other crimes that are taking place if they are already stretched in police numbers due to austerity cuts over the years? What is their capacity to cope going to be, especially when the police themselves are reporting that up to 1 in 10 officers are currently self-isolating due to some significant some symptoms that they may have experienced. So that in itself is quite concerning. Beverly Hughes of the Greater Manchester, Deputy Mayor for Policing and Crime, said that there had been increased reports of abuse linked to the coronavirus lockdowns. So there's obviously been a rise recognised by some of the police there. Detective Chief Inspector Dan St. Quintin of the Cumbria Police has asked delivery drivers, postal workers and food delivery companies, as well as carers, to keep a lookout for signs of abuse to report to the authorities. The police there are asking members of the community to help police their neighbours in looking out for signs of abuse, of domestic abuse victims, to help them in reporting those cases, to make sure that there aren't people there out in the community suffering in silence. But in terms of the policing, it's a very sort of difficult issue because the police are being asked to do so much more. Police resources are already limited due to those austerity measures, and they may well continue. They may well struggle to cope with so many other crimes now if they're spending their time policing and patrolling parks to maintain that social distancing. There will be less resources for other critical policing. Like, for example, I mentioned domestic abuse, but also child abuse and many other critical areas. What procedures will there be in place to help focus those more restricted resources into protecting the most vulnerable, those at risk of serious physical, psychological, financial, emotional, or sexual abuse? So that's a critical question to look at, especially with 1 in 10 police at the moment possibly absent due to self-isolating. So it's really sort of critical that people keep an eye out for their neighbours to make sure their well-being is okay. What about carers? There are up to 4 to 5 million people that are looking after a relative at home who's ill. And that's obviously going to be much harder for them. Many of them, will really be struggling without having a break or anyone else to talk to because of the self-isolating. And it also may be difficult for